All right, so for this deep dive, we're tackling tinnitus,
Uh-huh.
trying to figure out what causes this mysterious phantom noise,
Right.
and more importantly, what you can do about it.
Yeah.
We've got an expert in the field joining us,
Great.
and a whole bunch of research to sort through,
Okay.
including a really cool interview with a top tinnitus researcher.
Sounds good.
Let's dive in.
I think you'll find this pretty interesting, actually.
Okay.
Tinnitus is a lot more common than most people think.
Oh, really?
It affects like 1 in 7 people.
Wow.
So it's kind of a silent epidemic.
That is a lot more than I would guessed.
Yeah.
So before we get into the weeds,
Okay.
what exactly is tinnitus? Like, is it a disease?
It's actually more of a symptom than a disease itself.
Okay.
Basically, tinnitus is the perception of sound
Yeah.
when there's no actual external source for that sound.
So it's like your brain is making up sounds.
Pretty much, yeah.
Wow.
It can sound like ringing, buzzing,
Right.
hissing, whooshing,
Okay.
or even music. Huh.
Interesting.
And it's something that's been around for centuries. Like
Right.
even Charles Darwin
Oh, wow.
and Leonardo da Vinci
Oh, wow.
wrote about their struggles with tinnitus.
I had no idea.
Yeah.
I guess it does help to know that, like, even geniuses throughout history have dealt with this. So if these sounds aren't coming from an outside source,
Yeah.
where are they coming from?
Well, to really get to the bottom of that,
Okay.
we need to understand how our brains actually process sound.
Right.
You know, complete silence for the brain
Yeah.
isn't really silent at all.
Hmm.
There's always this like baseline level of neural activity, even when there's no external sound.
Okay,
Yeah.
so is tinnitus just that baseline activity that we just don't usually notice?
Not exactly.
Okay.
While that baseline activity is always happening,
Hmm.
tinnitus arises when the signals get kind of mixed up along the way.
Okay.
Usually sound waves travel through the ear,
Yeah.
and they trigger these electrical signals that go to the brain.
Right.
But with tinnitus, the signal can actually originate in the nervous system itself.
Hmm.
Basically bypasses the ear altogether.
So the brain is playing tricks on us,
You could say that, yeah.
generating these phantom sounds.
Yeah, one way to think about it.
So are there different types of tinnitus?
There are, actually.
Okay.
So subjective tinnitus is the most common type, and we don't really fully understand what causes it.
Okay.
Objective tinnitus, on the other hand,
Yeah.
is caused by like a physical issue we can pinpoint, like
Okay.
a blood vessel problem near the ear
Huh.
or muscle spasms.
Interesting.
Yeah.
Is there a way to tell what type of tinnitus someone has just based on the sound they hear?
Well, the sound can sometimes provide clues. In the interview we looked at,
Yeah.
the researcher actually described a whole range of sounds people experience. So some hear like a whooshing sound that's synced up with their heartbeat.
Oh.
Others hear like a clicking or phantom motor sounds. And some experience like high-pitched ringing,
Okay.
like after being at a loud concert.
All right, like that ringing after a concert.
Yeah,
It makes me wonder if loud noise is what causes tinnitus in the first place.
you're right. Noise-induced hearing loss is a big contributor to tinnitus.
Okay.
Those loud noises, and also things like aging.
Okay.
And even ear infections
Right.
can damage the tiny hair cells in our inner ear.
Oh, those little hair cells.
Yeah.
And those are responsible for...
They basically convert sound vibrations
Okay.
into electrical signals that the brain can understand. And once they're damaged, they can send like faulty signals to the brain,
Interesting.
leading to tinnitus.
So those hair cells are really sensitive.
Super sensitive.
You mentioned loud noises. And I remember learning that decibels, which we use to measure sound, aren't linear.
Oh, that's right.
So like a 10 decibel increase
Yeah,
is actually a 10-fold jump in sound intensity.
exactly.
That's crazy.
So a whisper might be around like 30 decibels.
Okay.
A normal conversation is about 60.
Mhm.
And a rock concert can be over 120 decibels.
Wow, that's loud.
Yeah. So it's easy to see how even short exposure to those high decibel levels
Right.
can do some real damage.
It definitely makes you think twice about turning up the volume.
Yeah, for sure.
But it seems like there's more to the tinnitus story
Uh-huh.
than just exposure to loud noises, right?
Yeah. You're right. It's almost never just one thing.
Okay.
Tinnitus is what we call multifactorial,
Okay.
meaning lots of different things can kind of come together to trigger it.
So what are some of those other things?
One of the big ones, and this might surprise you,
Okay.
is stress.
Stress.
Yeah.
What does stress have to do with it?
Well, when we're stressed,
Yeah.
our whole system is basically in overdrive. Our senses become heightened. We become more sensitive to everything,
Okay.
including those internal signals
Right.
that our brain might be misinterpreting as sounds. Oh, so like when I'm stressed and like every little sound seems louder?
Exactly.
Okay.
And it's not just sound.
Okay.
Stress also increases muscle tension,
Hmm.
which can be another piece of the tinnitus puzzle.
Oh, so you're talking about things like clenching your jaw or grinding your teeth?
Exactly.
Right.
That clenching and grinding,
Right.
which is also called bruxism,
Right.
can affect the temporomandibular joint, or TMJ,
Right.
which is right near the ear.
Right.
And any tension or misalignment in that joint
Yeah.
can potentially contribute to tinnitus.
I never would have thought of that connection.
It's pretty common, actually.
Huh.
And it's not just the jaw either.
Oh, really?
Even small misalignments in the neck,
Okay.
specifically the cervical spine,
Yeah.
can impact blood flow to the brain
Mm-hmm.
and cause that whooshing type of tinnitus.
So it all connected.
It really is.
Our bodies are like these giant networks
Yeah.
where any disruption can have these unexpected consequences.
So we've got stress jaw tension neck issues. It's like a detective story,
It really is.
trying to track down all the potential culprits behind tinnitus.
It is like that.
So with so many potential factors at play,
Yeah.
a one-size-fits-all approach isn't going to work right.
Right.
Like, I know things like white noise can help.
Yeah. White noise or sound masking can offer temporary relief,
Yeah.
but they don't really get to the root cause.
Okay, so what does all of this mean for someone who's dealing with tinnitus?
Mm-hmm.
Like, is there any hope for lasting relief?
Absolutely. There's definitely hope.
Okay, good.
But it requires kind of a more holistic approach
Okay.
that addresses both the physical and emotional sides of tinnitus.
So where do we even begin with this holistic approach?
Well, the first thing is to realize there's no quick fix.
Okay.
Managing tinnitus is a journey,
Right.
and it starts with understanding your own unique triggers
Yeah.
and figuring out what works for you.
So it's a personalized approach.
Exactly.
I like that. What are some of the first steps people can take?
Well, we know that good sleep hygiene is super important for overall health,
Right.
but it's especially important for people struggling with tinnitus.
Yeah.
So think about creating like a relaxing bedtime routine,
Yeah.
avoiding screens before bed,
Right.
making sure your bedroom is cool, dark, and quiet.
That's good advice for anybody, really.
It is.
But it makes sense that good sleep would be extra important
Yeah.
for managing tinnitus.
Definitely a well-rested brain
Mm-hmm.
can handle stress better,
Yeah.
and it's better at filtering out unwanted sounds.
Right. And speaking of stress,
Mm-hmm.
reducing stress is important too, right?
It's huge,
Oh,
yeah.
the-
Things like mindfulness and meditation can be incredibly helpful.
Okay.
They help calm down the nervous system
Right.
and reduce that overall sensitivity to sound.
So it's about quieting the mind and calming the body.
Exactly.
I like it. And this might seem obvious,
Yeah.
but it's important to deal with any underlying medical conditions.
Oh, absolutely. That could be contributing to the tinnitus.
Right. Things like high blood pressure
Yeah.
or TMJ disorders
Right.
can often make tinnitus worse.
Okay.
So managing those conditions
Mm-hmm.
can sometimes reduce or even eliminate those phantom sounds.
So it all comes back to that detective work,
Yeah,
figuring out what's really at the root of the problem.
exactly.
Okay.
And this detective work also involves
Yeah.
taking a close look at your diet.
Diet.
Mm-hmm.
You mean what I eat can actually affect my tinnitus?
It can,
Wow.
because certain foods
Yeah.
can increase inflammation in the body,
Okay.
including in the inner ear
Right.
and the nervous system,
Interesting.
which can make tinnitus worse.
So what kinds of foods are we talking about?
The usual suspects:
Okay.
gluten,
Yeah.
sugar,
Mm-hmm.
dairy,
Okay.
alcohol.
Right.
They can all contribute to inflammation.
And when you combine those things with stress and lack of sleep,
Exactly.
it's like a perfect storm for tinnitus. It really is.
It's wild to think about how everything is connected.
I know. It's fascinating.
From what we eat to how much sleep we get to
Uh-huh.
those phantom sounds we hear.
It really highlights the importance of that holistic approach to
Right.
manage tinnitus and really our health in general.
So we've got sleep, stress, diet, underlying medical conditions.
Yeah.
What else should people be thinking about?
The expert also really stressed the importance of getting a thorough medical evaluation.
Okay.
This includes things like a hearing test, blood work,
Okay.
and potentially even some imaging studies
Okay.
to rule out any other underlying conditions
Right.
that might be contributing to the tinnitus.
So it's about getting a clear picture of what's going on
Yeah,
and ruling out any red flags.
exactly.
That seems like a good first step
It is.
for anyone dealing with this. And once you have that information,
Right.
you can start working with your doctor.
Yeah, your healthcare providers
Right.
to come up with a plan that addresses your specific needs and goals.
It's good to know that there are options available.
Oh, yeah, tons.
It's not about just accepting tinnitus.
No, not at all.
It's about being proactive and taking steps to manage it.
Exactly. It's about taking control of your experience.
I like that. And that's where those additional therapies and supplements come in.
Right, like the binaural beats we touched on earlier.
Yeah, I'm really interested in that.
Yeah, me too.
Yeah.
But before we dive into that fascinating world,
Okay.
let's talk about some of the supplements
Right.
that are expert recommended,
Okay. Let's talk supplements.
like melatonin,
Yeah.
magnesium,
Mhm.
and ashwagandha.
Okay. I'm ready to hear more.
Great. And just remember,
Yeah.
while supplements can be helpful, they're not miracle cures.
Right. They're not a quick fix.
Exactly. They're tools that can support your overall health and well-being,
Right.
which can then help you better manage your tinnitus.
Okay. So let's start with melatonin.
Okay.
We talk about its role in sleep, but the expert also mentioned it could have a protective effect
Ah,
on the inner ear.
right.
How does that work?
Well, besides regulating sleep,
Yeah.
melatonin is also a powerful antioxidant.
Okay. Remind me, what are antioxidants again?
Antioxidants protect our cells from damage caused by free radicals,
Okay.
which are basically these unstable molecules that can cause damage throughout the body.
Right.
And it seems that melatonin's antioxidant properties
Yeah.
may actually help protect those delicate hair cells
Right.
in the inner ear
Okay.
that are so important for hearing.
So it's not just about getting a good night's sleep.
Right.
It's about supporting the health of our auditory system at a cellular level.
Exactly.
Okay, so then we have magnesium, which can be a big help,
Yeah.
especially for people who hold a lot of tension in their jaw.
Right. We talked about how jaw tension
Yeah.
can contribute to tinnitus.
Right.
And magnesium is really good for relaxing muscles. So if TMJ tension is part of your tinnitus, relaxing those jaw muscles with magnesium can really help.
That makes sense. And what about ashwagandha?
Yeah.
I've always thought of that as like a stress reliever.
It is.
But is there a direct link to tinnitus?
Well, not a direct link, but an indirect one. Yes.
Okay.
Ashwagandha is an adaptogen, which means it helps your body handle stress better.
Right?
And since we know stress is a big trigger for tinnitus,
Yeah.
anything that helps you manage stress
Uh-huh.
can indirectly help manage your tinnitus symptoms.
So it's like a chain reaction.
Yeah.
Reduce the stress and the tinnitus might lessen as well.
Exactly.
Okay. And again, these supplements are most effective
Yes.
when used as part of a comprehensive approach.
Absolutely.
So we're looking at the big picture.
Mm-hmm.
Sleep stress inflammation,
Yeah.
underlying medical conditions, structural issues like the TMJ and the cervical spine.
It's a lot.
It is a lot to consider.
But the good news is, the more we learn about tinnitus,
Right.
the better equipped we are
Mm-hmm.
to find solutions that really work.
That's good to hear. So armed with this knowledge,
Uh-huh.
you can start having those conversations with your doctor.
Yeah, your healthcare provider.
Right. Exactly.
And exploring all these different treatment options.
It's about taking control of your experience
Right.
and finding what brings you relief.
And speaking of finding relief,
Yeah.
let's finally talk about those binaural beats.
Okay, let's do it.
I'm ready to dive into this whole world of brainwave entrainment.
Yeah, binaural beats are like a sonic adventure for the brain.
Okay.
And they might just hold the key to a whole new level of tinnitus relief.
All right, I'm ready.
Let's go. It's wild to think about it,
Right?
that something as simple as sound
Yeah.
can have such a powerful effect on our brains.
I know, it's amazing.
It really shows you how connected the mind and body are,
Definitely.
like we've been talking about.
So let's get back to those binaural beats.
You said they have something to do with brainwave entrainment.
Yeah, that's right.
So what is brainwave entrainment?
It's basically the process of synchronizing your brainwave frequencies
Okay.
with an external stimulus, like sound or light.
All right, so what exactly are brainwaves then?
They're the electrical pulses that our brains produce as our neurons are communicating with each other.
So like the electrical activity of the brain.
Exactly. And these pulses happen at different frequencies, which we can measure.
So it's kind of like the rhythm of our brain activity.
Yeah, that's a good way to put it.
All right.
And different brainwave frequencies are associated with different states of consciousness.
Oh, okay.
For example, when you're feeling alert and focused, your brainwaves are mainly in the beta frequency range.
Okay.
But when you're relaxed and drowsy, your brainwaves slow down to the alpha or even theta range.
Interesting.
Yeah.
So how do binaural beats fit into all of this?
So binaural beats use two slightly different sound frequencies, one played in each ear.
Right.
And when you listen to them with headphones, your brain perceives a third frequency, which is the difference between the two original frequencies.
Okay.
And this perceived frequency can actually influence your brainwave activity, kind of nudging it towards the frequency of the binaural beat.
So if you're listening to binaural beats in that theta frequency range, your brainwaves might start to slow down.
Right.
And mimic that state of deep relaxation.
That's the idea.
Okay.
And some studies have shown that listening to binaural beats in those slower frequency ranges,
like theta and delta.
Yeah, like theta and delta,
which
are associated with deep relaxation and sleep, can lead to a reduction in tinnitus perception.
So it's like giving your brain a sonic massage.
I like that analogy.
That's a good one.
And the thought is that by calming the nervous system and shifting the brain into a more relaxed state, the tinnitus might become less noticeable or even fade into the background.
So are there different types of binaural beats?
Not necessarily. So binaural beats can be used for a lot of different things. Like relaxation focus, sleep enhancement. And yes, even tinnitus management.
So the key is finding the right frequencies.
Exactly.
For your particular needs.
Right.
So how do you know which frequencies are best for tinnitus?
It can be a bit of trial and error, but there are also resources out there that can guide you towards frequencies specifically for tinnitus relief.
All right. So are there other things
Yeah.
people can experiment with for managing their tinnitus?
Well, remember those supplements we talked about?
Yeah. Melatonin, magnesium, ashwagandha.
Right. They can all be helpful.
Right.
Melatonin not only helps with sleep,
Yeah.
but it might also protect those hair cells in the inner ear.
Right. That two-pronged approach.
Exactly. And magnesium can help relax those jaw muscles.
Yeah, that TMJ tension is playing a role.
Right. And ashwagandha helps the body deal with stress.
Yeah, which we know can make tinnitus worse.
Exactly.
So it seems like it all comes back to managing stress.
Yeah.
Getting good sleep. And addressing any underlying health issues.
And it all ties together.
That's good. Those are all good things to work on anyway.
They are.
But let's not forget about that initial medical evaluation.
Oh, right. That's important.
The expert recommended.
Yes, a comprehensive evaluation can help rule out any other medical conditions that might be contributing to your tinnitus and make sure you're getting the right treatment.
It's all about getting a clear picture of what's going on.
Exactly.
Okay, so we've got the medical evaluation, lifestyle changes, supplements, and now binaural beats. Seems like we've covered a lot.
We have, but remember, it's all about finding what works best for you. Right. What works for one person might not work for another. So it's important to experiment. And be patient.
I like that message of empowerment. It's not about giving up. It's about taking control.
Exactly.
And finding what brings you relief.
Finding what works for you.
And sometimes relief can come from the most unexpected places.
Oh, yeah, totally.
The expert actually shared a story about a patient who found relief from their tinnitus.
All right.
Through orthodontic.
Orthodontic.
Yeah, like braces.
Braces.
Apparently, this patient had a misaligned bite. That was putting pressure on their TMJ.
Interesting.
And after getting braces, their tinnitus got a lot better.
That's amazing.
It really highlights how even things that seem totally unrelated can actually contribute to tinnitus.
It's all connected.
It is. And it just shows how important that detective work is that we talked about.
Yeah, sometimes the solution is hiding in plain sight.
Right. So we've got stress, jaw tension, neck issues, diet, even orthodontics.
Wow.
It really is a full body investigation.
It is. And speaking of investigations, our expert mentioned another area that's often overlooked when it comes to tinnitus.
What's that?
The cervical spine.
Oh, right. We talked about how neck misalignments can affect blood flow to the brain.
Right.
And contribute to that whooshing type of tinnitus.
Yeah. But there's more to it than just blood flow.
Okay.
The cervical spine also houses the brainstem,
Right.
which is super important for processing auditory information.
So any disruptions in that area could affect how our brains interpret sound.
That's the thinking.
Okay.
And the expert even mentioned that old injuries like whiplash can have lasting effects on the cervical spine.
Wow.
And contribute to tinnitus years later.
I had no idea.
Yeah.
So what can people do if they think their neck might be part of the problem?
Well, there are a few different approaches.
Okay.
Chiropractic care, osteopathy, and physical therapy can all be helpful for addressing those structural issues in the cervical spine.
So it's about finding a practitioner.
Exactly.
Who understands that connection between the neck and tinnitus.
Absolutely. It's about finding someone who can assess your individual needs and develop a treatment plan that's tailored to you.
Okay, so we've got the TMJ, the cervical spine.
Yeah.
Anything else structurally we should be looking at?
Believe it or not.
Okay.
Even the muscles in your inner ear.
Wait, there are muscles in our ears.
There are. They're tiny.
Okay.
But they're responsible for things like protecting the inner ear from loud noises.
Okay.
And regulating the transmission of sound vibrations.
How do those muscles contribute to tinnitus?
Just like any other muscle.
Yeah.
Those tiny ear muscles can become tense or spasmed.
Okay.
Especially in response to stress or loud noise.
And that tension could disrupt the normal transmission of sound signals, leading to tinnitus.
That's the idea.
Wow.
And the expert mentioned that some people find relief through therapies that target those inner ear muscles.
Okay.
Like sound therapy.
Interesting.
Or even specific massage techniques.
There are so many different pieces to this puzzle.
There are.
It really is complex.
It is.
So we've talked about the different types of tinnitus, potential causes, and some promising treatments.
Yeah.
But for someone who's feeling overwhelmed by all this information, what's the most important takeaway?
I think the most important thing is to remember that you're not alone.
Yeah.
Tinnitus is incredibly common.
Right.
And there are many paths to finding relief.
Yeah.
It's about changing your relationship with the sound, not necessarily silencing it completely.
That's a good point.
It's about taking control of your experience and finding what works for you.
And a big part of that comes from understanding where your tinnitus is coming from.
Absolutely. And that's where our detective work comes in.
Right. How do we start piecing together the clues?
The expert laid out a pretty clear roadmap.
Okay.
First, acknowledge the emotional impact.
Okay.
It's okay to feel frustrated, angry, or even scared. Tinnitus can be a real burden.
It can be.
And it's important to address those feelings.
So don't ignore those emotions.
Right. They won't just go away.
Okay.
In fact, ignoring them can actually make the tinnitus seem worse.
Wow.
It's about acknowledging and accepting those emotions.
Right.
But not letting them consume you.
Okay. And once you've addressed the emotional side, it's time to start investigating those potential physical causes.
Exactly. And the expert broke those down into 3 main areas.
Okay.
The temporomandibular joint, or TMJ.
Right.
The cervical spine, and your overall metabolic health.
Okay, let's start with the TMJ.
Okay.
I'm still fascinated by that connection between jaw tension and tinnitus.
It is pretty wild.
It seems so counterintuitive.
I know, right?
It's one of those things you wouldn't think of until someone points it out.
And then it's like, oh, of course.
Exactly.
The expert explained how even subtle misalignments in the TMJ can put pressure on nerves and blood vessels.
Interesting.
Which can potentially contribute to tinnitus.
So if you clench or grind your teeth, that could be a big clue.
It could be.
And that's where things like dental splints, massage therapy, or even physical therapy can come in to help realign the jaw and release that tension.
Exactly.
Okay, so that's the TMJ. What about the cervical spine?
The cervical spine is another area where structural issues can really mess with the nervous system.
Yeah.
Think about it. Your head is balancing on top of this delicate structure.
Right.
Any misalignments or restrictions can affect blood flow and nerve signaling, potentially triggering or worsening tinnitus.
And we talked about whiplash.
Right, that sudden jolt to the neck can really throw things out of whack even years after the injury.
Wow.
It's like a ripple effect that can impact your nervous system long term.
So chiropractic care, osteopathy, or physical therapy.
Right. Might be helpful
Yeah.
for those structural issues in the neck. They can be.
All right, now what about metabolic health?
Okay.
How does that
Yeah.
tie into the tinnitus puzzle?
Well, our bodies are incredibly complex.
Right.
And everything's interconnected.
Yeah.
So when our metabolic health is out of balance,
Okay.
it can lead to inflammation throughout the body, including in the inner ear and the nervous system.
And the expert mentioned
Yeah.
gluten, sugar, dairy, and alcohol as potential culprits.
Those are big ones.
Right.
They can really contribute to inflammation.
And when you combine those with stress,
Right.
lack of sleep,
Right.
and other lifestyle factors,
Exactly.
it creates a perfect storm for tinnitus.
It really does.
It really shows how important it is
Yeah.
to look at the big picture
Yeah.
when it comes to tinnitus.
Absolutely.
It's not just about your ears.
It's not.
It's about your whole body.
It's about how well everything is working together.
Right. So we're listening to our bodies, addressing those underlying physical issues,
Yeah.
working on stress management and sleep.
Those are big ones.
Are we missing anything?
Well, the expert also emphasized
Yeah.
the importance of getting that comprehensive medical evaluation.
Right. That initial evaluation.
Exactly. That includes things like a hearing test,
Yeah.
blood work,
Okay.
and potentially even some imaging studies
Right.
to rule out any other medical conditions.
So it's about ruling out those red flags
Exactly.
and getting a clear picture
Yeah.
of what's going on.
Right.
And from there,
Yeah.
you can work with your healthcare team
Uh-huh.
to develop a personalized plan
Exactly.
that addresses your specific needs.
A plan that works for you.
It's good to know that there are so many options available.
There are.
It's not about passively accepting tinnitus.
No.
It's about proactively taking steps to manage it.
It's about taking control.
Right. And that's where those additional therapies and supplements come in.
Right, like the binaural beats we talked about.
Yeah, I'm really curious to learn more about those.
Me too, but before we dive into that fascinating world,
Okay.
let's take a step back
Yeah.
and talk about some of the other supplements.
Like melatonin, magnesium, ashwagandha.
Yes, remember, they're not magic bullets,
Right.
but they can be helpful,
Okay.
especially when combined with those lifestyle changes and other therapies.
So let's break them down one by one.
Okay.
We talked about melatonin for sleep,
Yeah.
but the expert mentioned
Uh-huh.
it might also have a protective effect on the inner ear.
Right. Melatonin is a powerful antioxidant.
Okay.
And it seems to help protect those delicate hair cells in the inner ear.
Right. Those hair cells are so important for hearing.
They are.
So it's not just about getting a good night's sleep.
Right.
It's about supporting the health of our auditory system at a cellular level.
Exactly. And then we have magnesium,
Right.
which can be a game changer,
Yeah,
especially for people with a lot of tension in their jaw.
that makes sense. Magnesium is known for relaxing muscles.
Exactly. And if TMJ tension is contributing to your tinnitus, relaxing those jaw muscles can make a big difference.
Okay, what about ashwagandha?
Yeah,
I've always thought of that as a stress buster.
it is.
But is there a direct connection to tinnitus?
Not directly, but indirectly, yes.
Okay.
Ashwagandha is an adaptogen,
Right.
meaning it helps your body cope with stress.
Uh-huh.
And since stress is a major trigger for tinnitus,
Right.
anything that helps manage stress
Yeah.
can indirectly help manage your tinnitus symptoms.
It's like dominoes.
Uh-huh.
Reduce the stress.
Yeah,
And the tinnitus might lessen too.
that's a great way to put it.
And again, these supplements are most effective as part of a comprehensive approach.
Right, looking at the big picture.
So we're looking at sleep, stress, inflammation.
Yep.
Underlying medical conditions.
Yeah.
Structural issues.
It's a lot.
It is a lot to consider.
But the good news is,
Yeah.
the more we learn about tinnitus,
Right.
the better equipped we are to find solutions that work for you.
So you can start having those informed conversations with your doctor.
Yeah, your healthcare provider.
Right.
And exploring all these different avenues of treatment.
It's about taking control of your experience
Exactly.
and finding what brings you relief.
Finding what works for you.
Speaking of finding relief,
Yeah.
let's talk about those binaural beats.
Okay, let's do it.
I'm ready to dive into this fascinating world of brainwave entrainment.
Let's go. Binaural beats are like a sonic adventure for the brain.
Okay.
And they might just hold the key to unlocking a whole new level of tinnitus relief.
Okay. So if you're just joining us,
Uh-huh.
we're really getting into this world of binaural beats
Yeah.
and how they might help people manage their tinnitus,
Right.
as we talked about before.
Mm-hmm.
Binaural beats use those two slightly different frequencies.
Right, one in each ear.
Yeah.
To create that auditory illusion
Okay.
that can influence brainwave activity.
So it's not just like a cool sound effect.
No, it's more than that.
It actually uses the brain's ability
Yeah.
to synchronize its own electrical activity
Uh-huh.
to these external rhythms.
That's right. It's called brainwave entrainment.
Okay, so brainwave entrainment.
And what's really cool is that different brainwave frequencies are associated with different states of consciousness.
Oh, so like when you're super focused on something?
Yeah.
Versus when you're like about to fall asleep?
Exactly.
Your brain waves are in completely different patterns.
Totally different patterns.
So how does this all connect back to tinnitus relief?
Well, studies have shown
Okay.
that listening to binaural beats, especially in those slower theta and delta frequencies, can actually reduce how much people perceive their tinnitus.
And those are the frequencies linked to relaxation and sleep, right?
You got it.
Makes sense that calming the nervous system and shifting the brain into a more relaxed state might make the tinnitus less noticeable.
Less noticeable, or maybe it even fades into the background.
So what's the best way to experience these binaural beats?
Our expert recommends
Okay.
listening with headphones
Yeah?
in a quiet environment.
Okay.
Find a comfy spot, close your eyes,
Yeah.
and just let those sounds kind of wash over you.
That sounds really relaxing.
It is. It's a really gentle, non-invasive way to possibly manage your tinnitus while also promoting relaxation and well-being.
I like that. And you also mentioned something called phase locking or phase trapping.
Right. What was that again?
Yeah. What's that all about?
It's basically a technique
Okay.
that combines binaural beats with music that's specifically designed to further enhance that brainwave entrainment.
So it's like taking binaural beats to the next level.
Exactly. Layering these different sounds creates this more immersive experience that can be even more effective at guiding the brain towards that relaxation and reducing tinnitus perception.
So where can people find these like brain-altering soundscapes?
There's a ton of resources online. And apps. You can search for binaural beats for tinnitus. Or just experiment with different frequencies. See what works for you.
Are there any other sound-based therapies for tinnitus?
There is something called notched sound therapy, which involves filtering out the specific frequency of the person's tinnitus from music or white noise.
So you're like creating a custom soundscape that targets their specific tinnitus frequency.
Exactly.
That's so cool.
The idea is that by removing that specific frequency, the brain can gradually get used to it not being there, which can lead to a reduction in how much they notice their tinnitus.
It seems like we're just scratching the surface. When it comes to understanding
our sound
to influence our brains and our health.
It's a really exciting field.
It is. Well, we've covered so much today.
We have.
From lifestyle changes to supplements to sound therapies. As we wrap up this depth dive into tinnitus. What's the most important takeaway you want to leave our listeners with?
If you're struggling with tinnitus, just know that there's hope. There are so many ways to find relief. And it starts with taking an active role in understanding your triggers and exploring the different options that are out there.
So it's not about just giving in to the tinnitus.
No.
It's about becoming an active participant in managing it.
Absolutely. And remember, this is just the beginning of your journey. There are tons of resources out there. Keep learning. Keep experimenting.
And keep advocating for yourself.
I like that.
You have the power to change your relationship with tinnitus. And find strategies that bring you relief.
Well said. And who knows? Maybe along the way you'll discover some hidden sonic superpowers.
You never know.
Thanks for joining us on this deep dive.
It was my pleasure.
Into the fascinating world of tinnitus.
It's fascinating.
Until next time.
Yeah.
Keep exploring, keep learning, and keep diving deep.